I will now check your blood pressure. Please relax your arm.
Okay.
Your blood pressure is within the normal range.
Limb alignment is suboptimal. Assessing distal perfusion and neurological response. Initiating temporary immobilization protocol.
Vital signs stabilizing. Continue oxygen therapy. Administering analgesic. Please remain still. Monitoring vital signs. Your PCR test confirms a viral infection. We need to start antiviral treatment and isolation immediately.
I understand, doctor. What does this mean?
Commencing cardiac assessment. Analyzing ECG data. Administering oxygen.
How are you feeling? Just relax, everything is okay.
Based on the initial assessment and the data from your joint imaging, we are observing signs consistent with early-stage inflammatory arthritis.
Please try to follow my breathing. Inhale slowly through your nose, hold for a moment, and exhale slowly through your mouth. You are safe.
Increasing fluid resuscitation. Prepare for continuous renal replacement therapy.
Assessing for rebound tenderness. Internal analysis suggests several potential diagnoses based on current data.
Assessing skin turgor. Mucous membranes are dry. BP 90/60, heart rate 1.
Fast assessment initiated. Patient, can you smile for me? Raise both arms. State your name and today's date.
Slurred speech.
It's not pain, but it's a left out there. We did as one of you knew, but I'm pleased. Used to thought world anti.
Assessing acute dermal inflammation. Allergen exposure probable. Preparing antihistamine protocol.
Based on the imaging and urine analysis, we've identified several small kidney stones.
Okay, what does that mean for me?
Assessing for dehydration and toxin exposure. Please describe your symptoms.
Tell me about your pain history and how it's been affecting your daily life.
It started a few years ago after the accident, mostly in my lower back.
I am starting the irrigation. Please try to relax. The saline will help neutralize the chemical.
Based on the analysis, the laboratory values indicate consistent with anemia.
Administering bronchodilator. Monitor oxygen saturation. Vital signs fluctuating. Potential internal bleeding detected. Initiating immediate intervention protocol.
Based on your latest results, we need to adjust your current nutritional plan to better support your recovery.
Initiating pediatric resuscitation protocol. Airway clear. Commencing rescue breaths.
Blood pressure dropping. Internal hemorrhage indicated. Initiating fluid resuscitation.
Commencing intravenous hydration. Monitoring vital signs. Administering lorazepam 4 milligrams. Seizure activity ceased. Vital signs stabilizing. I'll be attaching these sensors to monitor your sleep patterns. Please try to relax. Please take a deep breath in
and then exhale fully into the mouthpiece.
Administering saline. Preparing sterile dressing. Monitoring vital signs.
Epinephrine administered. Airway secured. Monitoring vitals.
Please smile for me.
Attempts to smile, speech slightly slurred, like this.
Blood type O negative confirmed. Commencing transfusion. Regulating flow. Vitals stabilizing.
Initiating trauma assessment. Vital signs critical.
Checking your temperature now. You're a bit warm, but we'll get that down. How are you feeling?
Your latest tests show a slight imbalance in your thyroid levels, which we can manage with a small adjustment to your medication.
Pain levels are decreasing. Vital signs stabilizing. How are you feeling today, Mary?
A little tired, but all right.
Please look straight ahead.
E-F-P-T-O-Z.
Let's take a closer look at this area. The scan indicates some minor inflammation. Assessing oxygen saturation. Adjusting flow rate. Patient response is being monitored.
Can you feel this?
Nên nghĩ là tôi thì sẽ bị sao. Tận đã kỹ trong pha và đầy sốc quần áo bị cha bằng ngạt. Hai ní em thấy cả thể nó.
Assessing airway obstruction. Vitals critical. Preparing for intubation. Laryngoscope ready. Visualizing
Gently now, extend your leg. That's it. Focus on the muscle. You're doing very well.
Deep breath now. You're doing wonderfully.
Based on the scan, we're seeing some inflammation here, but it's manageable with the right approach.
I am here to help you. You are safe.
Prep for immediate surgical intervention. State. Just a little longer and you'll be feeling much better. How is your pain on a scale of 1 to 10? The initial scan indicates normal organ structure and blood flow. We will now examine the area more closely.
The preliminary scan shows everything is within normal parameters. We will proceed with a more detailed analysis now.
Take this medication twice daily, once in the morning and once in the evening, with a full glass of water. I am now going to check your blood pressure. This cuff will inflate automatically. Please relax your arm.